I'll keep my talk fairly simple. What I'm going to talk is about transsexual health and the specialty. Transsexual health is a unique specialty. Usually, a doctor makes a diagnosis and advises treatment. But in transsexual health, it's just the opposite. The person comes with a diagnosis and the person dictates what treatment he or she wants. The person comes and says that I have a gender identity issue and I want hormones, I want surgery, I want hair removal treatment, and so and so. So it is unique. The other unique thing about this specialty is that it consists of a huge number of team members. It is a teamwork. Someone say, I mean, I was told that I'm a psychologist. Actually, I'm a psychiatrist, so I'm basically a doctor. So the team consists of psychiatrists. It consists of psychologists. If the person has psychological problems, transition barriers, coming out to family, social problems, mental health problems, etc. Then we have gender nurses, we have gender social workers, we have endocrinologists, we have surgeons, we have hair removal treatment specialists, and we also have an image consultant. Image consultants are quite few, they are rare species, but they help transgender people mannerisms, makeup, how to behave, how to talk, how to walk, and all the stuff. Um, the treatment of transsexual people in UK is totally free. The government bears all the costs, and I hope such things happen in India. Starting from outpatient consultations, hair removal treatment, speech and language therapy treatment for voice modification, hormone treatment, and surgery, top surgery, low surgery, everything is totally funded by NHS England, which is really great, and we are really proud of it. And I really want this to happen in our country, India, where people are very poor and they cannot afford this expensive treatment. The journey of a typical transsexual person in the UK is like this. When they are sure of their gender identity, after having experimenting, researching, knowing from other transgender people, when they are sure and when they feel they are ready to come out, they speak to their parents or they speak to their GP, they speak to their friends, then the GP makes a referral to the specialist service. So we have about 3 years waiting period, and the patients are seen after about 3 years. So it's quite a long wait. And we already have 800 patients on the waiting list. The patient is seen by two different psychiatrists at two different times. The first psychiatrist will make a diagnosis. The second will confirm the diagnosis. And once the diagnosis is confirmed, we initiate hormones. After the person has been on hormones for about 1 year, we refer them for surgery. In a trans man, they are desperate for top surgery, mastectomy with chest reconstruction, and they may or may not go for 𝗱𝗶𝗄𝗄𝗧plasty because young people, they are very aware, they are just waiting for some better operative techniques to come out in the future, and at that stage, they will opt for 𝗱𝗶𝗄𝗧plasty. Uh, Vaginoplasty is fairly favored by trans women. In the elderly age group, if the trans woman is in their 70s, 80s, they are not sexually active, they have physical health problems, they would just go for a cosmetic vulvoplasty than a fully functioning vaginoplasty. The whole journey from being from seeing us in the outpatients clinic to finishing their surgery would take about 3 to 5 years. One of the problems which we are facing now is people want to detransition, and we have many court cases against us. People sue us that you're given us the wrong treatment, we are not happy, and we want to detransition back. So in this case, we always take a thorough history, the diagnosis is confirmed, and then only we initiate treatments. I don't think I have to talk more about the journey, but if there are any questions, I'm more than happy to answer. Yes.
Sir, we have a question from Dr. Kavita Arora.
Yes.
She's asking, how often have you encountered post-surgical regret?
I don't have the exact figures, but at least there are a few, many of them on the newspapers and all that. But it is increasing now, you know. Though we make a thorough diagnosis, sometimes it happens that people after surgery, they really regret the surgery and they want their breast back, they want their penis back, they want to um, have their hair again, or they want to remove the hair, the facial hair I'm talking about. I'm sorry, I don't have the exact figure, but detransition cases are increasing now.
Thank you. Thank you for answering that, Dr. Vaidya. I'm just going to put my video on.
Yes.
And I know we may not have an answer to this, but I thought I would ask you because we have both you and Dr. Parmar with us. Do you feel there are any predictors to this regret? Any predictors you can see or any patterns you have seen that may actually help you to recognize that such a particular profile may actually lead to or has more likelihood of?
It's a difficult question, but one thing recently, research has shown that there is an association of autism with gender identity disorders. And there are about 6 to 8% of people with gender identity disorders have comorbid autism. In these comorbid people with autism, they are the ones who are more likely to regret the surgery because of the theory of mind, not able to understand the perspective. We may have missed the diagnosis, or they have, and the one thing we have noticed is that transsexual people, they really push us, you know, they push their boundaries. They want the treatment as early as possible. They cannot wait. And so sometimes we are forced upon to initiate treatment, and then we end up regretting. But it's very hard to find out what are the predictive factors that a certain patient may want to detransition and will regret the transition. Chetan, if you have anything to add.
No, I think you covered most of the emerging aspects of it. I mean, the desisting, I mean, I think it's called more like desisting now. I mean, as we was hearing earlier, your vocabulary keeps changing. So detransitioning is changing into desisting. But the aspect of sort of that is quite complex, I think. And as I was mentioning earlier, that, you know, transition starts from pre-transition sort of counseling. And I think one of the aspects of expectations that people have of treatment is quite important to highlight. And I've heard it elsewhere as well, that, you know, people have sort of sometimes have expectations which, you know, they find that they cannot fulfill even after treatment. And I think that's quite a big aspect of people then regretting going through the change. It's not, and you know, having spoken to a number of them myself, I mean, from personal experience, a lot of times it is not the fact that they still do not consider themselves to be transgender. The aspect is about the expectations, I think. And I think that's quite important for anybody who's starting a transition to be, you know, properly counseled about.